in continuation with last day's class, today we will discuss further on some of the cases regarding the overall topic of sterilization and disinfection. And so, another case here, several patients develop infections with MDR Klebsiella pneumoniae. MDR means multi-drug resistant, and Klebsiella is a gram-negative bacteria. Following endoscopic procedure, review of the endoscopic processing protocol shows inadequate cleaning prior to high level disinfection. What does this mean? That means that routinely endoscopes are disinfected with high level disinfectants. However, I think in last class I had given an outline about the CSSD. So in CSSD, after these instruments are received, they are cleaned to get rid of the organic matter that are present on the instruments. Now, if this organic material is present, that means disinfectants will not have their level of activity. And if that happens, microorganisms can still survive on these instruments. So, on the next patients, if these instruments are used on, infections can spread. That is what has happened. So to understand that, you need to understand what are the critical steps of endoscope, how they are processing done. Okay. Similarly, let us take another example. Over here, in an operating room is cleaned with phenolic disinfectant. Procedure is done well. But after that, it was seen a patient had severe phenol allergy experiences after the operative procedure. That means the process of disinfection was done, but it was still not conducive for human operative process. That means whatever chemicals that we are using can harm both the person who is applying the disinfectant as well as even to the people who will be using those areas, be the patient, be the doctor, be the healthcare worker, anybody could be affected. Hence, you should also not only know about the efficaciness of various chemicals, but also know the adverse effect that these chemical reagents may pose both before and after use. Okay. So let us look at the disinfectants. In the last class, I already showed you this. So disinfectants are of three types. One would be the high level, intermediate level, and low level. In the high level disinfectants, we have the aldehydes, paracetic acid, and hydrogen peroxide. Now let us look one by one. So recall what are high level disinfectants. High level disinfectants, they can kill all microorganisms and bacterial spores when used in sufficient concentration under suitable conditions. What do I mean by that? These are not sterilant. Okay. So you need to have sufficient concentration as well as some prerequisite conditions. Otherwise, it will not be effective. The first aldehyde. Now, what are aldehyde? I think in your chemistry classes so first point that you can see, it is used on semi-critical. It is used on semi-critical items. Now, what are semi-critical items? What are semi-critical items? লাস্ট ক্লাসে তো পড়ানো হলো। হ্যাঁ, আরে এটা তো ডিসকাশন ক্লাস রে বাবা, মুখ টিপে বসে থাকলে হবে? স্পল্ডিংস ক্লাসিফিকেশন কি ভুলে গেছো? ক্রিটিক্যাল আইটেমস, সেমি ক্রিটিক্যাল আইটেমস অ্যান্ড নন ক্রিটিক্যাল আইটেমস। তো তার মধ্যে সেমি ক্রিটিক্যালটা কি? হ্যাঁ, which type of body fluid? sterile তাহলে ক্রিটিক্যালটা কি নন স্টেরাইল বডি ফ্লুইড লাইক এক্স্যাক্টলি ঠিক আছে like the endoscope they enter into the areas which do have microorganisms, okay, but there is no penetration of the mucous membrane like endoscopes. So all those are disinfected with glutaraldehyde. Okay, this is a high level disinfectant. It is also used for aerial disinfection and cleaning and like fogging. What is fogging? Fogging is a method by which an area or room can be disinfected. For example, suppose we have a patient who is highly infectious, was admitted in a particular, suppose this is the room. Now, what will be the outcome of the patient? Either the patient will get better or the patient might succumb to the illness. Whatever the case may be, after the patient leaves the room, you need to disinfect the room. Okay. If it is highly infectious, we need to thoroughly clean. How to do that? One of the method is fogging. I'll come to that later. So this can also be used for fogging. Fogging means to spray in the air so that all the surfaces can be disinfected. So the concentration that is commonly used is 2% concentration, and once activated it remains for 14 days. Very important part, I have already told you, high level disinfectant you need two important conditions. What is the concentration and contact time, and what is the prior cleaning done or not. That means if the endoscopes are not cleaned properly prior to disinfection, your disinfection process will fail. That is the first requisite. Second requisite will be what is the contact time and concentration. You need to remember these two. First is the concentration is 2% and contact time is at least 20 minutes. For what? For normal bacteria. But if you are trying to kill the spores, you need higher contact period. Okay. So can it be used for sterilization? Yes. We need a higher concentration and a longer period of contact time. But when we are using endoscopes, we are not expecting spores. Okay. The mucous membranes of the human body, for example, the gastrointestinal tract, we have bacteria, but they are not spores. So for that, 20 minutes is sufficient. But please remember, 20 minutes is the minimum contact period. Similarly, we also need to learn about the advantage and disadvantage. What are the advantage? See, it remains active in presence of organic matter. That means some of the disinfectants will fail, but glutaraldehyde will not fail. Only thing is that if organic matter is present, you need a higher contact period. But if you use glutaraldehyde, the chances of failure are less. Like the question, the first case that I had elaborated, that was the case. However, it does have some disadvantages, like first of all, it has a pungent odor, like most of the aldehydes, can cause eye irritation, occupational asthma, and contact dermatitis. Now, who will be exposed? The people who are involved in disinfection process. So for that, you need proper personal care equipments. How a person can come in contact with glutaraldehyde? Through skin and through nose and eyes. So you need proper masks, eye protective equipments, and gloves. Okay. Next comes is ortho-phthalaldehyde. Advantage of this one is that it does not require activation. For glutaraldehyde, you need to activate two chemicals mixed to regenerate the active glutaraldehyde. Over here, you don't need to activate, so it is much easier to use. You can pour it from the container and use. It has the less odor, less irritant, but it does not kill spores. So you cannot use it as a sporicidal agent. However, it does produce staining of intact skin. If it comes in contact with skin, it causes discoloration of the skin. So all the protective equipment must be maintained. Next comes is formaldehyde. I think you are all acquainted with formaldehyde, obviously. Now it is very high. Formaldehyde is very good, excellent disinfectant. Biggest problem with formaldehyde is a pungent odor, irritant, causes serious skin irritation, and is also a potential carcinogen. Few years back, formaldehyde was used extensively in the hospital disinfection purposes, but now it is not recommended at all, especially for fogging. Because if you fog with formaldehyde, people will inhale, and there are chances of developing carcinoma further on. So it is largely restricted to non-patient care area. That means where the people are not going to come in contact. I think it is used as an embalming agent. You all know that. Okay. Problem is that for surgical instruments, formaldehyde sterilization is not recommended because of unexpected results. So, from today's point of view, use of formaldehyde is very much restricted. So, as far as aldehyde are concerned, two important aldehydes you should remember. One is glutaraldehyde, another is ortho-phthalaldehyde. Glutaraldehyde is extensively used, can be used for semi-critical items. What are semi-critical items? Which come in contact with mucous membrane. For example, endoscope. And for glutaraldehyde, you need to know that at least 2% concentration should be used for a contact period of 20 minutes for viable bacteria. Okay. Next is paracetic acid. Paracetic acid is used in automated machines and manual immersions. These are used to sterilize materials like endoscope, surgical instrument, dental instrument, mostly used in the industrial area. All the pre-packed instruments, those are sterilized by this. It can also be used. Next comes hydrogen peroxide. Hydrogen peroxide is extensively used in the hospital care, but at varying concentration. How does hydrogen peroxide act? Nascent oxygen, that is the free radical, which causes the damage. Now it is poricidal only at 4 to 5%. Remember this. The concentration is important. Normally for wound disinfection or surface fogging, we use 3%. For 3 to 6%, we use for like contact lens, tonometer, prisms, ventilator fabrics. This can be used. Higher concentration is used in case of plasma sterilization. In the last class I have told you one of the methods to achieve sterilization is plasma sterilization. Over here hydrogen peroxide is used, but the concentration is 6 to 7%. Now what is the advantage? It is rapidly acting. Nascent oxygen directly damages, it's a free radical, it directly damages all viable cells. Furthermore, it is non-toxic. After the disinfection is over, you can easily use the room, area or surfaces. It will be non-toxic after the contact time is over. And a very important point is it is active even in presence of organic matter. This is one of the reasons why, especially like in road traffic accident or mutilating injuries, we clean the wounds with hydrogen peroxide, because not every time it is possible to wash or clean all the organic debris that is present. Okay. Now, if you remember that, you will understand that hydrogen peroxide can act even in presence of organic matter. Disadvantage is number one, it is expensive. It is very much expensive. So it is not used everywhere. We need to use it only in specific conditions. And the next problem is you have to store it very properly. It will degrade to form nascent oxygen. It can containers can swell up if it comes in contact with higher temperature or direct sunlight, it will degenerate. So proper storage is also very important. Okay, so these are the high level disinfectants. So basically we have aldehydes, paracetic acid and hydrogen peroxide. In the aldehydes we have glutaraldehyde, ortho-phthalaldehyde and formaldehyde, which were used earlier but now it is not recommended. Now coming to intermediate level of disinfection. We have a vast range of intermediate level of disinfectants. Let's start with the most commonly used one. This is the alcohol. So commonly in the clinics you will see people are using isopropyl alcohol for skin disinfection. How does alcohol act? How? How? Alcohol is dehydrating and very good. তাহলে স্কিনে দিলে স্কিনটাও তো ডিহাইড্রেট করে দেবে। It causes denaturation of protein. Dehydration যেটা তুমি বলছো, yes, alcohol does, and that's how tissue fixation is done. That's for histopathological purposes. We are not using that higher concentration. Okay. So, like high level disinfectants, for intermediate level of disinfectants, concentration is very important. Okay. The same alcohol, if we use 90-95%, will have different action than what we use on say 70% alcohol. So concentration is very important in these cases. Now, most commonly where are alcohol used? For asepsis of skin, instruments which come in contact with skin like a ECG probe, a thermometer, this can be cleaned. And very importantly, for alcohol based hand rub. What are alcohol based hand rub? Sanitizer. Okay. Why alcohol is used? We have three types of hand hygiene. One is hand wash, one is hand rub, and the other is hand scrub or surgical. So what is hand rub? What is the difference between hand rub and hand wash? Acha. Okay, fine. What is the difference between the word wash and rinse? আচ্ছা কি মুশকিল, আমি বললাম রিন্স ইউর হ্যান্ড, ওকে বললাম ওয়াশ ইউর হ্যান্ড। তাহলে তুমি কি শুধু আঙুলগুলো ধুয়ে ছেড়ে দেবে নাকি? আরে বাবা, জামা কাপড়ের ওয়াশিং ইনস্ট্রাকশনে কি লেখা থাকে? রিন্স দ্য ক্লোথ উইথ ওয়াটার, দেন রিন্স মানে কি? জলে ভেজানো। ওয়াশ মানে ইউজিং সোপ লাইক মেটেরিয়াল, সোপ অর সোপ লাইক মেটেরিয়াল। বোঝা গেছে? মনে থাকবে? তাহলে যখন আমি বলছি হ্যান্ড ওয়াশ, তার মানে আমার কি লাগবে? মিনিমাম soap and water. That is the minimum requirement. Okay. So for hand washing we need a sink, water and soap. Liquid soap, solid soap, whatever. But we need that. But every time আমরা ওয়ার্ডে যাচ্ছি, একটা ওয়ার্ডে অনেক কটা পেশেন্ট আছে, একটাকে এক্সামিনেশন করলাম, পরে পেশেন্টটাকে যখন এভরি টাইম যদি আমি হ্যান্ড ওয়াশ করতে যাই, দ্যাট ইজ আইডিয়াল, but that is sometimes also not feasible because not every ward will have many sinks. You need a sink, you need a water connection, you need soap, everything. Furthermore, তুমি যদি প্রত্যেকটা পেশেন্ট দেখার পরে হ্যান্ড ওয়াশ করো, the act of hand washing will have some deleterious effects on your skin of the fingers also, fingers and hand. Okay. Alcohol can achieve a certain level of disinfection provided there is a catch. What is the catch? Provided your hands are visibly clean. তার মানে কি? No organic matter present. If there is any organic matter present, alcohol will not act. বোঝা গেছে? So how does alcohol based hand rub work? It contains alcohol. When you rub your hands, the alcohol disinfects your hand and it vaporizes. You don't need to go to the sink to wash off. And because alcohol vaporizes faster, the time of hand hygiene gets reduced. So you can move to examine one patient to the another much quicker. Please remember, provided your hands are visibly clean. Okay. Next, you can use disinfecting smaller non-critical instrument like thermometer or an ECG probe, small medical devices like vaccine valve. I think in blood culture for culture, before we open the blood culture bottle, we clean the top of the bottle with alcohol. So these can also be used. Okay, they are not sporicidal, but viable bacteria will be killed. Another important is like non-critical areas like lab bench. I'll come to it later when discussing how disinfection actually is done. Now, disadvantage is alcohol is flammable. This is a very important disadvantage. So you need to store it properly, use it properly, and you have to make sure that in the ward or in the area where you are using, it doesn't come, it does not lies near say electrical point or a instrument which uses a high load of electricity, because there are chances of catching fire. So it is a very important fire hazard in the hospital setting. Next important comes are phenol. I think almost everyone are at least acquainted about how floors of the house are cleaned. Okay, even then there also phenols are used. But if I have to ask you, will the phenyl that is commonly used in a household, will it be effective in a hospital setting? Why? So what will be the most important limiting factor over here? It's the concentration. So household cleaning agent may contain phenols but at a very low concentration. But in the hospital setting, we need a higher concentration. Now, how does it act? It acts as a protoplasmic poison, disrupt the cell wall and cell proteins. So commonly cresol and lysols are used, but very important, it is toxic to skin. Please remember, household phenols are not toxic. They do have phenols, but at very low concentration, it does not produce toxicity. But the phenols that are used in the hospital setting are toxic to the skin. So whenever you are using, you need to make sure that the person who is doing the disinfectant are well protected with gloves and proper footwear, because footwear is a very neglected area. And furthermore, like alcohol can be used to disinfect skin, you cannot use phenol as a disinfectant of skin. And lastly, a very important is this one. In last class, I told you sometime you will read about tuberculosis later on, but many a times you will find that patients are treated at home for tuberculosis, they will cough out, and every time they cough out, there will be mycobacterium, the bacteria will come out from the sputum, and that is infectious. So the patient, household, neighbors, they can also get infected. So you need to disinfect that sputum. So how to do it at home? By using phenol. Remember the concentration, because concentration is very important. If you say go back home, buy a phenyl and cough out in a container with phenyl, it will not work. That phenol should be at least 5% concentration. Okay, advantage is it's very commonly used, active even in presence of organic matter. Disadvantage is many, toxic to skin, irritant. Next comes halogens. What are halogens? So commonly used halogen is iodine, tincture iodine. So how does it act? There are two types. One is tincture iodine, which contains 2% iodine, and another is a povidone iodine. The tincture iodine is used for antisepsis of skin before doing any process. But please remember, it does not cause damage to intact skin. That is fine. But if the skin is not intact, it can cause damage. So if you are using iodine for skin asepsis, before you puncture the skin, remove the iodine. বুঝা গেছে? Another is hypochlorite. Hypochlorite will liberate chlorine ion. That chlorine ion will cause disinfectant. Hypochlorite is very commonly used in the hospital setting, in the laboratories, for disinfection of surfaces and potentially infectious material. For example, whatever clinical specimen is sent to the laboratory, all are potential infection. They are all infectious. So after testing, what we need to do? We need to disinfect them. How to disinfect? Using hypochlorite. So hypochlorite, it is prepared. Hypochlorite, when it is activated, it will liberate free chlorine. That free chlorine will cause disruption of the cell wall and cell protein, thereby causing death of the bacteria. So what will be the concentration? It is available at 0.5 to 0.6%. It is diluted to 0.5%. Commonly used concentration is 0.5% for the normal hospital settings. Okay. So routine cleaning is done with sodium hypochlorite. What are the advantages? They are broad spectrum, rapidly acting, non-flammable. Unlike alcohol, you can store it, you can handle it easily, and it is widely available and it is very cheap. These are the biggest advantages. Disadvantages that you should know: it is inactivated by organic matter. So if we do need to disinfect a surface like a floor or say a OT table, if there are organic matter like blood or body fluid present, first we need to clean them. Then only we can use hypochlorite. Otherwise, its action will fail. Furthermore, whenever we are using hypochlorite, protective equipment should be there. Otherwise, it can cause damage to skin and mucosa, and it is also a potential carcinogen. Next comes heat-based method. Among the heat-based method, one is pasteurization. I am not going to depth with pasteurization. I think most of you know what is pasteurization. Hmm? What is pasteurization? Look at this diagram. Pasteurization was a method that was devised by Louis Pasteur so that milk can be made edible. Okay. So bacteria not all bacteria not get rid of. The spores might be there. However, you can drink it. It will not cause any disease. How it is done? Milk is heated rapidly and suddenly cool down. So whenever there is a sudden change of temperature, it will cause thermal shock. This thermal shock kills the bacteria. Yet it keeps the protein that is present in the milk intact. So the nutritional value of the milk is not degraded and the viable bacteria are killed. Spores are not killed. Okay. That is one method. Another method that is very commonly used in the household, can also be used, is called as boiling. So how does boiling kills? Simple, high temperature. So at least 20 minutes of boiling water. After the water starts boiling, 20 minutes exposure should be there. Again, boiling will kill viable bacteria, not spores. Another method is steaming. Difference between boiling and steaming is, in boiling we are using water in the liquid form, and in steam we are using the gaseous form. Difference between steaming and autoclave will be pressure and temperature. In autoclave we reach a higher temperature, hence it is sporicidal, but steaming is not sporicidal. Another method is inspissation. Any idea what this is? This is used especially for egg based culture media. Now, why the problem with the egg based culture media? What happens to egg protein when it is heated? It coagulates, denatures. So, if we are trying to make any, say, not even culture media, some of the vaccines are also egg based vaccines. There are many chemical, many reagents that are, you have proteins which can be denatured with heat. So what can we do? We raise the temperature to that point so that the protein does not denature, like 50 or 56 degrees centigrade. By that temperature, most of the bacteria will get killed. Again, we do the same procedure after 1 day. Why 1 day? Spores, if they are remaining, will germinate, and the next day it will get killed again. We repeat at least 3 times. So if we go and do the same thing, probably most of the spores will germinate and kill in the next day. That is the problem. However, these are not absolute methods of sterilization or disinfection. Next is UV radiation. UV radiation causes direct damage to the nucleic acid. It can be used by placing the items or the instruments we are targeting to disinfect directly under the UV lamp. These are UV radiation very helpful, especially in case of bacteria and viruses, but are not effective against spores. The disadvantage of UV radiation is UV radiation itself is harmful to human body. Now coming to low level disinfectants. So these are all intermediate, okay? There are many methods. There are physical methods, there are chemical methods. So what are the physical methods of intermediate level of disinfection? What can we use? Heat in the form of pasteurization, boiling or steaming. We can use radiation in the form of ultraviolet radiation, and the chemicals. Among the chemicals, important would be alcohols, phenols, iodophors, that means iodine and chlorine. Among chlorine, please remember sodium hypochlorite. In iodine, tincture of iodine. Coming to low level disinfectant, what are low level disinfectant? They destroy vegetative bacteria and enveloped viruses. May have variable action on non-enveloped viruses, on fungi, but have no activity on tubercle bacilli or spore. এটা মনে রাখো, predominantly vegetative bacteria উপর যেটা কাজ করে সেটাকে আমরা বলি low level disinfectant. Now what are these low level disinfectant? First is quaternary ammonium compound. What are quaternary ammonium compound? There are ammonium compounds in which there is quaternary structure. These are used for predominantly used for cleaning purposes, routine cleaning. Normal hospital ward, corridors, এগুলো যদি ক্লিন করতে হয়, we need low level disinfectant. That means viable bacteria থাকলে সেগুলোকে মেরে দেবে, spores force এগুলো মারতে পারে না. The second would be chlorhexidine gluconate. It is also extremely used. Advantage is it does not cause damage to skin, so it can be used for skin antisepsis. I think many of you have used mouthwashes like Listerine, they contain chlorhexidine. It kills vegetative bacteria but has minimum or no effect on skin or intact mucous membrane. Hence, they are extensively used. Only thing that you should remember, you can use chlorhexidine for skin antisepsis in almost every patient except children less than 2 years, because their skin are very thin, much higher absorption can occur. Okay. Other than that, you can use. So, chlorhexidine is extensively used in hand hygiene products, in mouthwashes, in body wash solutions, and in all the kinds of hand scrubs that are used by the surgeons before performing a surgery. They will kill all the viable, that is the vegetative bacteria on the skin surfaces also. Advantage is that it has got a residual activity. What is residual activity? What is residual activity? Hmm? थोड़ा जोर से बोलो, सुनाई नहीं. Yes, that means, for example, if I take an object, I autoclave it. Now it is totally sterilized. I have put it in a packet. The moment I puncture the packet, the sterility will be compromised because autoclaving has got no residual activity. Even if you touch the instrument with the bare hand, it has become unsterile. Chemical disinfectants have what is known as residual activity. If you use chlorhexidine, the activity of the chlorhexidine will remain for a prolonged period of time. This is very helpful for skin asepsis and even for hand hygiene. Once you use a hand wash and then use a chlorhexidine based hand scrub, what will happen? The residual activity will remain on the hand wash. Your hand hygiene or asepsis of the hand will be maintained for a longer period of time. But the disadvantage is that its action is slower, activity is pH dependent, and is greatly reduced in presence of organic matter. কনটেক্সটটা বোঝো তাহলে 3টা পয়েন্ট মনে থাকবে, নাহলে মনে থাকবে না. So if you are trying to use chlorhexidine for hand hygiene, first we need to wash the hand with soap. হাতে organic matter থাকলে it will not work. Secondly, if you are trying to use it on any surface, we need to assure that the surface has not been acted on by any chemical which can alter the pH. pH change hole activity will be compromised. Secondly, action is very slower. Like hydrogen peroxide activity is very fast. The moment you apply it, but chlorhexidine will take time. That means you need to have contact time. যদি স্কিন অ্যান্ড সারফেস যদি ডিসইনফেক্ট করা হয়, at least 15 minutes should be the waiting time. Then only you can use it, otherwise not. Till now you have understood, for low and intermediate level of disinfectants, even for high level disinfectants, we need to get rid of the organic matter as much as possible. Now, how can we get rid of the organic matter? By using cleaning agent. Most of the cleaning agent will have soap or soap-like materials. So this is very important to remove any kind of organic matter present anywhere. It could be surface, solid surface, instrumental surface, or even hands. Now, what are the points you should remember about cleaning agent? It should be easily emulsifiable, saponifiable, water softening, non-toxic, and have surfactant like action. You know everything, none of the points are alien to you. What is saponifiable? সোপ কিভাবে কাজ করে? মনে পড়ছে? It forms a mishal. Why it should be emulsifiable? What is emulsifiable? If you cannot mix it with water, you cannot use it. So it must be emulsifiable. Then it should be water softening. Not necessarily your healthcare setting will have water with soft quality. Water may be hard. So your cleaning agent should have the ability to work even in presence of hard water. And finally, obviously, it should be non-toxic because the cleaning agent will also be used or will come in contact with human skin. So it should be no, you cannot use a toxic agent. So these are the points you should remember about the cleaning agent. So the cleaning agent will have soap and one more important thing, it will also have enzymes. Why enzymes? Because soap alone cannot get rid of most of the organic matter. You need some sort of enzymes which will act on the organic matter, degrade them, and then the soap will clean them. So most of the agents that are used will come in this kind of formulation, which will have soaps and enzymes in a emulsified form, and they can be directly used with water. Now next is methods. It could be manual method, it could be automated method. I think you have seen these kind of machines used in airports and railway stations where large areas are cleaned with machines. Advantage is that because machines are doing it, a lot of area can be covered at a short period of time. Manual methods advantage is that careful and delicate work can be done. Not everywhere you can use machines. And even still in India, manual labor is cheap. That is very important part. Now these are the few points you should remember how cleaning is done. First is cleaning followed by disinfection. This order must be maintained. First the area should be cleaned, then disinfected. Never the other way around. Otherwise your disinfection process will fail. Next is you should clean, the work should be done from cleaner to dirtier area. Why this is important? For example, suppose this is a room. This is the area where the patient has the bed and patient lies there. And suppose that corner is the toilet. So how the cleaning will proceed? The cleaning will proceed from the door to all the area. The toilets will be cleaned at the end. Why? Exactly. If you do the other way around, the process might contaminate the whole area. So you have to keep the clean areas cleaner. So the process should move from cleaner to dirty area. Next is high to low. What is high to low? From high touch areas to low touch areas. What are high touch areas? And what are low touch areas? Next time you go to ward, just try to observe what are the areas or surroundings of the patients which are highly touched by healthcare workers and which are very less likely to be touched by the healthcare workers. Right, starting from the door of the ward or the ICU. The first high touch area will be the handle of the door. It will be touched in a higher probability than the door panels. Then, if you logically think, next would be the patient bed rails. Most of the time, you will go to the patient bed and touch the rails. The instrument beside the patients. If the patient is having any automated instrument, people will touch the, like the ECG monitor or the probes, those will be highly touched. So while cleaning the patient surrounding, the high touch area should be cleaned first and then the low touch areas. Why? Because the probability of presence of organisms in the high touch area are higher than low touch area. Next would be to inwards to outwards. Remember the antisepsis during I have told during blood collection for culture, it is cleaned from inwards to outwards. Same concept from cleaner to dirty area, so that the area once you have cleaned does not get dirtier because of your cleaning technique. Then frequency of cleaning will depend on probability of contamination, vulnerability of the population of infection, and frequency of hand contact. Let me explain this point. I'll give you three examples. First is OPD, that is the outpatient department. Second is a operating room, and third is a transplant ward. Now you tell me in which area this cleaning method, sterilization, disinfection should be the most stringent. Stringent means the best method should be followed in which area. Why? Simple. They have patients who are immune compromised. So organisms which are not generally known to cause disease will cause disease on those population or those patients. They are vulnerable areas. So we need a stringent protocol. Next comes is a surgery room, operative room, where people will enter into the body areas which are normally sterile. So there are chances that organisms might be introduced into those areas. So we need a stringent protocol. Maybe not as stringent as that in the transplant ward, but still we need proper sterility so that we do not introduce any organism within the patient. Right? And lastly is the outpatient because the probability of infection is low. Okay, so based on what is the location, what is the type of population we are handling, what are the procedures we are doing, and how many times we are doing, that will determine how, where, and when this protocol should be followed. So this is a routine outline, like non-critical areas and surfaces should be cleaned about 2 to 3 times, mattresses cleaned once weekly. This is a protocol, but this is not a hard and fast rule. I've already told you it will vary on the area, whatever the procedure that are done in that health service unit, and also on the patients. For example, if you visit the neonatal intensive care unit, these protocols are very stringent because we are dealing with neonates. They are very vulnerable to any sort of infection. The same kind of protocol may not be followed in the pediatric ward, where we are dealing with children, but they are much less vulnerable than neonates. Okay, now look at this picture. This is what fogging is. We use a machine called this fogger machine to form a fog. Obviously, you know what a fog is. This machine suspends the disinfectant in the air. Slowly, this disinfectant will settle down on all surfaces, from walls to ceilings to surfaces, and after the contact time, it will cause disinfection of the surfaces. There are many methods of testing sterilization. One of the methods is known as the Riddle-Walker or phenol coefficient test. What is a phenol coefficient test? The standard that is taken is phenol. So if a disinfectant is highly active, it is rated against how many times it is better than phenol. Other test will be Chick-Martin test, ENUS test. If you want, you can go and read. Indicators, in the last class I already told about indicators, physical indicators, chemical indicators, and biological indicators. I'll just show you the pictures. So physical indicators will be the indicators that are shown on the machines, like temperature, pressure, etc. Chemical indicators have many categories like class 1, class 2, 4, and 5. These will be the clinical chemical indicators. The color will change when the exact process, that is either temperature, pressure, is fulfilled. There will be change of the color. And finally, we have biological indicators. These are the tubes which will have spores of a particular bacteria. After the process is over, we try and go for the culture. If there is growth, that means the sterilization was ineffective. If there is no growth, that means the sterilization is effective, and the growth will be indicated by change in color of the media. If the bacteria goes, it will use up nutrients, it will form acids, there will be change on pH. The change of pH will indicate the change of color. Okay. Now this is the overall picture that I want you to understand. On the left hand side, we have susceptible to resistant. This susceptible to resistant is actually on the agents we are using for sterilization and disinfection. This is the pyramid. Most resistant one are the prions, because the prions are not living material, they are infective proteins. And the least are lipid or medium sized viruses, that is the enveloped viruses. They are the least resistant. Even simple alcohol based, that is the sanitizer that you use, can neutralize them. Next comes the vegetative bacteria, then the vegetative fungi, then spores, non-enveloped viruses, mycobacteria, parasites like cryptosporidium, then bacterial spores. Okay. So for them we need to use this sort of things. Like low level disinfectant will act on enveloped viruses, vegetative bacteria, vegetative fungi. Okay. If we need higher, we need to go for high level disinfection, which will act not only on this but also on fungal spore, non-enveloped viruses, mycobacteria also. If we need to go and kill the spores, bacterial spores, we need to achieve sterilization. And for prions, we can use autoclave, but for that, the temperature is 134 degrees centigrade at a higher pressure at a higher contact period of at least 1 hour. So it can be used aided with mineral acids or bases. Okay, so this is the overall picture that I want you to understand. Now, look at these pictures. We have to clean and disseminate all surfaces that are likely to be contaminated with pathogens of the infected patients. It should be at least once a day, twice a day is preferred, and personal protective equipment must be worn by the person who is involved in the cleaning. Now look at this picture. Where we are dealing with large surfaces, we can use machines or manually, but for other things like these instruments, we need to do manual cleaning. This is for surface disinfection. Next is, look at this picture. This person has started cleaning from that side, moved, came down, moved, came down. That means he is not going over the same area twice. This is the method we have to follow for cleaning any kind of surface. Finally, what you need to know is what is called as terminal cleaning. What do you mean by terminal cleaning? Terminal কথার মানে কি? শেষ. So when the patient leaves the room, the outcome might be death or discharge, whatever may be the outcome. After the patient or the patient body leaves the room, we need to make sure that room is conducive for the next person. That means we are not allowing transmission of the same pathogen from the previous patient to the next patient. This is called as terminal cleaning. Understood? So to do the terminal cleaning, first we need the assessment of what was the cause of the patient's death, etc. Then we need to know the supplies. Why we need to know the supplies? That will depend on what was the infective agent. If the see, a multi-drug resistant Klebsiella, for that we can use low level disinfectant. It can kill a patient very quickly, but we can use a low level disinfectant. But say if the previous patient was infected with mycobacteria, we need high level disinfectant. We cannot use a low level so depending on what the information, the assessment, we need to ascertain the supplies we need. Supplies mean the type of the disinfectant, the type of the materials. Based on that, we need hand hygiene and protective equipment. Then first we need to clean the patient area. Why the patient area first? Because that area is probably the most contaminated. After that, again we have to do the hand hygiene because we have disinfected the most contaminated area. Then disposal of all the areas, all the equipments, for example the linen, the bedding, have to be disposed separately. After all this is done, then we need to go for surface disinfection, floors, walls, others. And finally, then we need to clean the patient's bathroom or the toilet that is used. This is the process by which terminal disinfection is done. It's not rocket science, it's plain simple logic. Once you have understood, you have understood for the life. Okay. Finally, the last picture. These are the areas highlighted in green color are the areas of high touch surfaces. Just look at this image and ask yourself why these are high touch surfaces. Simple. Let's start from the left hand side. The drawers and the table surface, most of the time people will keep documents, files, folders, will open the drawers. The handles will be the high touch surfaces. These bed railings by which the patient's bed alignment is adjusted, these are high touch surfaces. The bed rails, the fluid lines, the curtains, the chair handles, and other like the oxygen nozzle, the suction nozzles, these will be high touch surface. So whenever we are approaching a patient bed, first we need to clean the high touch surfaces first and then the low touch surfaces. Okay. After having read all this, understood everything, we also need to keep care of our hands because not only the patient but we also spread the infection by touching one thing after